Major Depressive Disorder, MDD. The dark depths of the psyche. Comprehensive definition. Major Depressive Disorder, MDD, known in psychiatric literature as a profound mood disorder, transcends a passing feeling of sadness or melancholy. It is a deep-seated, debilitating, and persistent condition that significantly diminishes the quality of life for the affected individual. In this intricate and distressing state, the person is ensnared by a profound and continuous feeling of sadness, as if there is no glimmer of escape. This agonizing sensation is accompanied by a pervasive loss of pleasure in all daily activities, even those that were previously sources of joy and satisfaction. Chronic and exhausting fatigue, which does not alleviate even after sufficient rest, drains the individual's energy and motivation. Sleep disturbances, including prolonged and distressing insomnia or excessive hypersomnia that prevents the individual from performing daily tasks, are also prominent indicators of this disorder. In more severe and profound cases, MDD can lead to the formation of suicidal thoughts, which signify the deterioration of the individual's condition and the necessity for immediate intervention by mental health professionals. This type of depression, with its destructive impact on various aspects of life, can severely impair the individual's ability to perform work duties, pursue education, and maintain healthy and meaningful social relationships, trapping them in a cycle of isolation and ineffectiveness. Comprehensive examination of major depressive disorder with specific indicators. To gain a better and more precise understanding of the nature of major depressive disorder, it is necessary to examine this disorder based on numerous indicators, each of which illuminates a specific aspect of the affected individual's experience. 1. Severity of symptoms. The symptoms of major depressive disorder are typically severe and debilitating, significantly impairing the individual's functioning to the extent that performing the simplest daily tasks becomes an arduous challenge. This intensity of symptoms prevents the individual from fulfilling their various roles within the family, workplace, or educational setting. 2. Duration of symptoms. According to diagnostic criteria, symptoms of MDD must be present for at least 2 weeks continuously for a definitive diagnosis to be made. However, it is important to note that this period can also be episodic, with intervals of improvement and relapse, or chronic, with symptoms persisting for a longer duration. 3. Temporal pattern of occurrence. In major depressive disorder, unlike some other types of depression, such as seasonal affective disorder, the temporal pattern of symptom occurrence is usually constant and persistent, without a specific association with seasonal changes or a particular time of year. 4. Nature of psychological symptoms. Psychological symptoms in MDD encompass a wide range, the most prominent of which include profound and pervasive sadness, lack of motivation and interest in activities, avolition and anhedonia, feelings of worthlessness and excessive and inappropriate guilt, and, in severe cases, suicidal thoughts. These thoughts can range from passive wishes for death to active planning for suicide and require immediate attention. 5. Accompanying physical symptoms. Major depressive disorder is often accompanied by numerous physical symptoms, among the most common of which are sleep disturbances, including initial, middle, or terminal insomnia, or conversely, excessive hypersomnia, significant changes in appetite and weight, unintended and substantial loss or gain, and chronic and exhausting fatigue that does not improve with rest. 6. Age of onset. Although major depressive disorder can occur at any age, it usually begins in adulthood. However, unfortunately, the prevalence of this disorder in adolescence is also increasing, and early diagnoses and treatment during this period are of particular importance. 7. Underlying physical conditions. Major depressive disorder may occur in conjunction with certain chronic physical illnesses, such as cardiovascular diseases, diabetes, autoimmune diseases, and having these conditions may increase the risk of developing depression. However, the presence of an underlying physical condition is not necessarily a prerequisite for a diagnosis of MDD. 8. Presence or absence of psychotic symptoms. In some severe cases of major depressive disorder, the individual may also experience psychotic symptoms, including delusions, false and irrational beliefs, or hallucinations, unreal sensory experiences. However, in many cases, MDD occurs without these psychotic symptoms. 9. Mood swings. A significant differentiating feature of major depressive disorder compared to bipolar disorder is the absence of mood swings in the form of manic or hypomanic episodes. In MDD, the individual's mood is typically persistently depressed, and significant shifts towards euphoria and increased energy are not observed. 10. Response to pharmacological and psychotherapeutic treatments. Fortunately, in most cases, major depressive disorder responds to standard treatments including antidepressant medications and various forms of psychotherapy, such as cognitive behavioral therapy or interpersonal therapy. However, in some individuals, the depression may be treatment-resistant and require more advanced therapeutic approaches. 11. Influence of environmental stimuli. Traumatic events and severe life stressors, such as the loss of loved ones, financial difficulties, abuse, can act as triggers for the onset of MDD in susceptible individuals, or lead to the exacerbation of symptoms in those already affected. 12. Behavioral characteristics. Individuals with major depressive disorder often experience social withdrawal and show less inclination to interact with others. Reduced levels of daily activities and a lack of interest in performing routine tasks are also common. In some cases, especially in adolescence, self-harming behaviors may also be observed. 13. Cognitive changes. Major depressive disorder is associated with significant changes in the individual's cognitive functions, including impaired ability to concentrate and focus, recurrent negative and self-critical thoughts, and deep feelings of worthlessness and guilt. These cognitive changes can also negatively impact decision-making and problem-solving abilities. 14. Specific symptoms of each type of depression. In major depressive disorder, profound sadness and anhedonia, loss of pleasure, are recognized as key and characteristic symptoms that are of significant importance in diagnosing this disorder. 15. Presence or absence of motor symptoms. In some individuals with major depressive disorder, psychomotor retardation or even partial immobility may be observed. However, these symptoms are usually not as severe as those seen in catatonic depression. 16. Influence of genetic and familial factors. Research has shown that genetic factors and a family history of mood disorders play a significant role in increasing the risk of developing major depressive disorder in individuals. 17. Emotional state after onset of illness. With appropriate treatment and necessary follow-up, complete recovery from major depressive disorder is possible. However, unfortunately, the likelihood of relapse is also relatively high, and many individuals may experience multiple episodes of depression throughout their lives. 18. Symptoms concurrent with other mental disorders. Major depressive disorder often occurs concurrently with other mental disorders, among the most common of which are anxiety disorders, personality disorders, and substance use disorders. The presence of these comorbid conditions can complicate the diagnostic and treatment process. 19. Patient's socioeconomic status. Studies have shown that social and economic poverty and stress resulting from financial difficulties can act as risk factors in the development and exacerbation of major depressive disorder. 20. Manner of onset and reporting of symptoms. Symptoms of major depressive disorder typically manifest directly with feelings of sadness and lack of motivation, and the individual may clearly complain about these feelings and the loss of pleasure in their life. However, in some cases, symptoms may manifest indirectly through physical complaints or behavioral changes. Recommendation. If you are also interested in topics related to mental health, a deeper understanding of depressive disorder, and effective treatment strategies, we sincerely invite you to join the growing community of the Mental Today channel. In this valuable channel, you can benefit from specialized and evidence-based education, valid self-assessment tests, and practical tips to improve the quality of your mental life and that of your loved ones, taking an effective step towards promoting mental health in society.